here we are. We're still talking cholesterol.
Yeah, still cholesterol. We'll probably go
Because
for like 2 more.
as educated as I have been and as you have been on the concept of cholesterol, it's a very complicated topic. And we want to get to the bottom of it, not only for you to help you understand what this means, ultimately what it means for you in terms of what you could and should be doing to optimize your ability to age and to have a healthy aging heart and brain. Is what we want to get to the bottom of. So we defined HDL, LDL, and triglycerides. Let's talk total cholesterol, because it's not uncommon for a patient to come in with their blood work and with a report that says they've been to see their doctor, their cholesterol is elevated, and it's been suggested that they go on a medication to help lower their cholesterol, which is a statin. It's a particular type of a drug that addresses the cholesterol. So let's talk about total cholesterol, what it means as it relates to the HDL, LDL, the ratios.
So total cholesterol is just measuring how much cholesterol there is being shuttled around in your blood per unit of blood, right?
Okay.
So it doesn't really tell us much, it just tells us how much cholesterol is present. Now remember, cholesterol isn't bad, and so we have to then look at, okay, so is this cholesterol going to be atherogenic? Will it cause atherosclerosis? And the answer to that question is, well, does it deposit, right? Is it something that deposits? And then we focus in on LDL being the culprit for that.
And remember, LDL was like that dump truck that drives or transports the cholesterol to a space where we don't want it, because it can cause problems in that space.
So working off the dump truck analogy, if we were to look at what's typically measured on a blood test for LDL, that's actually ldl-c, which is the amount of gravel in the dump truck. It's the amount of cholesterol that's being moved around.
Right.
So this is the cholesterol number. Now we have something called NMR. It's a way of using nuclear medicine to look a little bit more closely at what's actually going on with these lipoproteins. And once we started looking at NMR, we realized that LDL-c, or LDL on a blood test, is only a useful predictor when it's concordant with ldl-p, which means when it follows the same trend as ldl-p, which is the actual particle number.
And I'm going to pause this for a second, because we're going to get to that. Let's, for this particular video, explain, does total cholesterol mean anything? Because oftentimes recommendations to take medications are based solely on total cholesterol.
It may not, but as of right now, it's not important clinically, at least not so much as to say that we should ignore the other stuff. I think that it's important to know the total cholesterol, but is it relevant to treating a person or deciding if they're at risk? Not unless we look at the other stuff.
Right, and this is something that I often point out to my patients, is that the reason their total cholesterol is high is because their HDL, which, if we're going to use the analogy of good and bad, remember the HDL cholesterol was typically the more helpful cholesterol in terms of more helpful lipoprotein in terms of getting the cholesterol to where it needs to be to do its job more effectively. So if your HDL is a little bit elevated, that'll drive your total cholesterol up, which can look alarming, because it'll put it'll put you out of reference range. It'll make you look elevated. And can sometimes cause unnecessary concern.
It can.
Yes.
And I will mention too, HDL is a bit of a funky thing, because we've come up with a few different drugs and a few different things, like even using high-dose niacin to raise someone's HDL, but it turns out that doesn't actually change their long-term risk of cardiovascular disease at all. So we still don't really know a lot about HDL, other than the fact that once we break it down to particle size, it seems like the smaller ones are a bit better for us, but we still, like, the jury's kind of out. But they are more safe. I wouldn't say that they're atherogenic.
Right,
Maybe.
right. So, so to simplify, for now, we will still consider HDL as being a little less problematic than some of the other particles. So, okay, so we'll leave it there, and the next video we're going to get into what is the true value to testing and what should we be testing or looking at.
Juicy stuff. That's the exciting part. That's what I'm looking forward to.
Yes.
Okay.